Magandang umaga mga kaibigan, panibagong araw ng pagsisilbi at pagkakasama natin dito sa ating WhatsApp Doc. And of course, dahil tag-init na naman, panahon ng maraming karamdaman. Kasama na po doon ang atake sa puso. Wala po rito ang ating kapartner si Miss Lynn Perez. We will miss her, but I think she's got some very important things to do. Ang inyong lingkod naman ay magkakaroon ng napakagagaling na mga panauhin. In fact, hahatiin po natin ang ating programa sa first half at second half. Yung pong ating first half ay tungkol sa kung papaano natin mapipigilan ang heart attack using our hands alone, mga kaibigan. Kung kayo po ay may mga kamag-anak na may alta presyon, may potensyal na atakihin sa puso, just by using your fingers and your hands, maaari po ninyo silang isave sa pagkakaroon ng matinding atake sa puso. We are very fortunate mga kaibigan dahil kapiling po natin ang dating Director General ng PTAC Department of Health. Mga kaibigan, let us welcome Dr. Jaime Diliaco. Good morning, Mr. Jaime Diliaco.
Good morning. Good morning to everyone. I'm very happy to be here. Englishin ko lang po kasi po yung bisita natin
He's from Texas,
is
USA.
from Texas. Gusto ko malaman niya kung ano sinasabi natin.
That is very good. And Mr. Diliaco, recently, about 2 days ago, you texted me about a seminar that you're giving for free para yung mga kababayan natin matuto kung paano wag atakihin sa puso. Ano nga po ba itong seminar nito?
Ito po, it's a free lecture.
Libre.
Libre, walang bayad. Tomorrow, bukas, from 7 to 9 p.m. sa Dasmariñas Association Hall, Campanilla Street, sa Dasmariñas Village sa Makati City. 7 to 9 p.m. po, Dasmariñas Association Hall sa Dasmariñas Village sa Makati.
All they have to do is go to Dasmariñas Village and ask about the lecture.
Opo,
Sa hall mismo.
sa hall mismo.
You know, the reason why I mentioned this early in our program, mga kaibigan, at sinabi natin itong libre, dahil ang atin pong magiging speaker has been giving lectures all over the United States para po sa mga military personnel, sa mga bumbero, sa mga nurses and doctors themselves,
Sa mga policemen.
sa mga pulis. At dahil doon po sa kanila, kapag inatake ka sa puso sa kalsada, minsan matagal bago dumating yung tulong. So immediately, you must be able to know how to stop a heart attack within 2 to 4 minutes. I repeat that mga kaibigan. How to stop a heart attack using your hands within 2 to 4 minutes. Talk a little bit about it, Mr.
Actually
Diliaco.
po, he has trained an entire U.S. Marine Division on this.
Marami yan.
Oh, kasi because it's not just stopping a heart attack, it's stopping bleeding in 4 minutes.
Bleeding in 4 minutes.
So
Hindi
even
lang yun. I think you are also mentioning other problems.
Oh. you can stop choking.
Choking. Yung nakalunun ba?
Oo, na hindi ka
Mabigat na bumara sa
hindi
leeg.
ka makahinga na.
Yes. Oo.
You can stop seizures,
O kumbulsyon.
convulsion.
Alright.
Tsaka you can stop anaphylactic shocks, yung allergic reaction to drugs or bee bites.
Oh yes,
Or-
dahil alam mo kapag nakagat ka ng bubuyog o kaya nakainom ka ng maling gamot, pwedeng ikaw ay kumbulsyonin and you know, you can immediately die.
Yes. And pwede po mahinto yan in 2 to 4 minutes.
Wonderful. We are already excited about this mga kaibigan. Ang ating pong panauhin, pagpasensyahan nyo na, it will be all English, pero later on you can call us up and probably ask us in whether Tagalog man ito o English man ito, and Mr. Diliaco will be very glad to translate it, no?
Yes, at saka ano pa po, isa pa. If you have had severe burns,
Okay.
this procedure can heal the burns in a matter of days, not weeks, not months,
Aba,
in a
maganda
matter
to.
of days.
Mapapabawasan yung hospitalization stay ng pasyente.
These procedures do not need a medical education. Anybody can do it. That's why we also invite for tomorrow's lecture, not just the army medics or the nurses or the surgeons or the physicians. We want to
Anyone.
invite everybody, the housewife.
Oh,
Yeah.
minsan lang po itong mga kaibigan dumarating sa Pilipinas, so let's not lose the chance of seeing it for yourself. And I promise you, I will be there and I will watch this and I will invite you personally mga kaibigan. Let us watch it.
I just want to say something.
Opo.
We already invited him here last November.
And how was the
the
Oo.
Philippine College for the Advancement in Medicine
Okay.
at the National Convention.
Okay.
And one of the attendants was a woman from Bulacan.
Oo.
Her name is Carol Nim.
Okay.
She was telling me last week
All right.
that she was here in Manila
Oo.
in a jeepney and it was held up. Somebody
Okay.
with a gun held up the passengers in the jeepney.
Let me guess. Either she suffered a heart attack or she was shot by,
No.
by one of these
No.
soldappers.
One of the passengers had a heart attack as a result.
Oh, ayun.
At iniisip niya, ano na ba yung sinabi ni Dr. King doon sa lecture?
So on the spot, naging medic siya.
On the spot, she stopped the heart attack in 4 minutes.
Dito sa pasahero ng jeepney.
Ng Disney. At saka sabi ng mga kapasahero niya, uy, ano ba yung ginawa mo? Saan mo ba yung natutuhan?
Mga kaibigan, this is like boxing already. We are so excited to watch already the Manny Pacquiao event. So ngayon, Mr. Diliaco, it's time, I think, to introduce our guest for today.
Yes, Dr. King, his name is Glenn King,
Okay.
is from Texas.
All right.
He has been teaching this for the last 15 years.
Okay.
So I said to a whole U.S. Marine Division, to cadets in West Point,
Okay.
to nurses, to surgeons, to physicians, to students all over the United States. Yeah, and to the general public who got to be interested.
And now we are glad
And now
he
we're
came to the
happy to have him
Philippines.
here with us.
And this is through PICAM.
This is through the Philippine College for the Advancement in Medicine.
Ayun.
And actually, if you have to go to the United States to study these procedures,
How much is it going to cost?
the tuition is $800
And
plus the airfare.
Plus the airfare.
Per class.
per class.
Yes,
Plus the airfare.
plus the airfare.
Plus your board and
plus
lodging.
board and lodging.
Which can easily come to about 2,000 or 3,000 US dollars.
Yeah, very easy.
That is about times 5. Wow, quite a big amount of money. And here, you will only spend 8 pesos for your transport fare.
Yes.
Ayan.
But
Without
just to
further
say
ado.
that it's only a 2-hour lecture.
Yes.
They will not study the whole procedures that Dr. King is teaching in the 5-day, 10-day courses.
Yes.
But they will learn the emergency procedures that we're talking about, like stopping a heart attack, stopping bleeding,
Oo.
stopping choking, stopping anaphylactic shocks.
O sige, pakilala na natin si Dr. King.
Okay.
Okay.
So this
Mga
is
kaibigan,
I'm
let's
very
give a round
happy
of
to
applause.
introduce Dr.
Mga
King.
kaibigan. Ayan. Dr. Glenn King. Good morning, Dr. Glenn King. Welcome
Good
to
morning.
What's Up, Doc.
Thank you for having me.
Ayan. Okay. Dr. King, how long have you been here now in the Philippines?
This time I've been here a week,
And you've been giving lectures, a
Yes.
workshop.
all day, every day.
And what is the workshop about?
The workshop is about training more of the therapy side of the key method, or what
Okay.
we call TKM. The TKM is an
TKM.
abbreviation of the key method.
What is the key method is TKM,
Right. And the key method, KI, means the King Institute method.
the King Institute method. Does it
Yeah.
have any relation to your last name?
Yes.
Oh, okay. All right. Okay. Now, you were showing me a magazine, Dr. King.
Yes.
Mga kaibigan, can we show this sa ating screen? Ayan. Dito po, sa Alternative Medicine Digest na ito, ay makikita ninyo one of the topic here sa ilalim. I hope we can show this on screen. Ayan, may lalapit ba? If you're going to look sa pinakailalim, mga kaibigan, nakalagay po dito, how to stop a heart attack with your hands in 2 to 4 minutes. So we're excited about this, Dr. King, already.
And that is
Go ahead,
the,
please.
actually the #1 alternative medicine digest magazine in the country for the U.S.
So tell us, who are the people who will be candidates for this stopping a heart attack? Like in this case, the passenger had a heart attack in the passenger jeepney.
Anyone, actually. We have actually had classes that were taught to teachers who go and teach mentally handicapped children,
Okay.
just basic one-step procedures to help them, and had one child in another class at another time help stop an emergency situation. So if that can happen, anyone can learn this.
Okay, I saw your book here, mga kaibigan. Let me show you some of the books that Dr. King has brought with us for us. Here, can we show this? Mga kaibigan, makikita po ninyo rito, they are using their fingers to touch certain points of the body.
Yes.
Okay? So now we are going to do an actual demonstration, if you don't mind, gentlemen.
Okay.
Halimbawa, for example, I am one of, just an ordinary guy watching television, and I saw beside me a person who is having chest pains. That person is my grandfather, 80 years old. Do I have to do anything immediately before I touch this patient?
Before you touch,
Before I touch.
there's nothing that will cause harm, but to have it be more effective, if they had a watch on, you'd want to remove the watch. If you had a watch on, you'd want to remove that.
So, any other metal that I have to remove from my body?
That's the most important.
My watch.
It would be
Okay.
best if it was all off, but if a heart attack's taking place, you want to help it just as soon as possible.
Okay. So, now, do I have to be at a certain composure, or do I have to be...
You can be in any position whatsoever, and what
Okay.
you would do is you would hold the left, not right, but left entire little finger.
Mga
Not
kaibigan?
to, not to
Okay.
squeeze it or anything, but you've also got the little finger here, and it goes all the way up. So what you do is grasp as much as you can. You don't squeeze it or anything, and then you place your right hand
Okay.
to T5. It's on the back. It's thoracic vertebrae number 5, directly on the spinous process.
Dr. King, so that it will be more effective for the people, perhaps it's best that while you explain, there will be two people doing this. So perhaps may I hold your hand, Mr. Diliaco?
Yes.
So, Dr. King, now what am I going to do? With my right hand or with my left hand, do I hold his finger?
It would be with your left hand, you hold the finger, and with
I
the right
hold the
hand.
finger of the patient like this.
So if you may turn for a moment.
Okay. All right,
that
mga
now you can
kaibigan.
hold
So,
the
ang ginagawa
thoracic.
natin is with my left hand, I hold the left small finger of the patient.
Yes.
I hold it like this. How hard?
Not hard. All you need is contact.
Just contact.
Do not squeeze.
Do not squeeze. So, just holding this. And with my right hand, where do I put now is it okay, FD, if we stand?
May I
Okay.
show you?
Okay. So, can you show that?
Now,
All right.
an easy way to do this, if you do not know where the fifth thoracic is just to bring your thumb up to a 90-degree angle
Okay.
and make it approximately level with the shoulder,
Level with the shoulder.
and then slide into the vertebrae
Slide in, mga kaibigan, like this.
and hold every vertebrae in that area. You'll hold about 3 vertebrae. One of them will be the fifth thoracic.
Okay.
If
So
you
yung
know
buto
where it's
nito sa
at-
likod, mga kaibigan, na nakaumbo is the thoracic vertebra. And you want me to hold the T5.
T5,
Okay.
right on the spinous process.
Okay.
So if you know where it is, go directly to it. Now, what we've seen is in every heart attack, the T5 has a subluxation that is making that protrude out. So you can
Okay.
easily find it, because if they're actually having a heart attack,
Okay.
that fifth thoracic vertebrae is going to be protruding out.
Okay.
Yes.
Now, what do I do now? With my left and my right hand, do I press here? Diinan ko ba ito, mga kaibigan?
No pressure whatsoever.
No
You
pressure.
simply contact,
Contact. Contact here and contact here.
and then you wait.
And I wait for how long?
It takes an average of 2 to 4 minutes. Although, during a heart attack, the person having a heart attack will immediately, upon contact, feel the difference, and the pain will start subsiding. It's 2 to 4 minutes that it takes for it to completely be alleviated. We've done this
2
over
to
and
4
over.
minutes.
Yeah.
Dr. King, let me ask you some questions here. If the person is suffering a heart attack, more likely that person is lying down.
It depends on the
Do I
severity
have-
of the heart attack.
Oh, okay. Do I have to sit him up? Or is it okay for him facing the floor?
I would leave them laying down and apply it laying down.
Okay, nakadapa, mga kaibigan. So, while the person is lying down facing the floor, my hand is like this and this one. Do I have to turn the head somewhere?
No, unless it's turned to where they can't breathe properly.
Okay, now this patient, if he's suffering from heart attack, is going to be shouting because of the pain in his chest. Do I get nervous
Not
about that?
necessarily. Sometimes the
Oh.
pain can be so severe they can't.
They can. What if he's passed out? Kung hinimatay siya, mga kaibigan,
If
Is it
it's
okay?
a heart attack, you still do the same thing.
do the same thing. Will I not be worried? Because right now, si Mr. Diliaco is not having a heart attack. I do not feel anything in his T5.
Right. And that would be a confirmation for you, in all of my experience, that if you feel that it would not be a heart attack. They may be having an anxiety attack or something else.
Ayun, mga kaibigan. Kung hindi nakaumbok yung T5, thoracic vertebra, baka iba yung kanyang kondisyon and not a heart attack. Do I have to straighten this arm?
No, it could be in any comfortable position.
Do I have to loosen up his clothing?
If he has thick clothing, of course, in the Philippines, that's not likely to happen.
Okay.
But if he has real thick clothing, you might want to go closer in for the skin, but you do not need skin contact.
Hindi kailangang hubaran mga kaibigan. Why? We don't have to undress him?
No,
No, not necessarily.
they might die by the time you undress them.
Ayun mga kaibigan. So what's important is immediately put this here and then this one here and forget about other things. Anyway, it's 2 to 4 minutes.
Yes.
Do I offer him something to drink like water?
I would just wait until he's stabilized.
Then you can offer him something to drink.
Yes, then give him comfort. I wouldn't have him do anything but relax and get him stable.
Well, for the therapist, you might need water.
Now, the thing is this procedure has worked consistently. We have personally used it hundreds of times, and we do not have one single incident that it has not worked. Although
Okay.
it is for the emergency situation, it is not corrective. There are
All
other
right.
procedures of the key method that you do because many different things can cause a heart attack.
Okay.
So you have to use other procedures to address the reason why they had a heart attack. This one is just to stop the heart attack, to save their life.
Okay. This should be done immediately, no?
Yes.
Can we sit down again?
Yes.
Do we have some more? Okay, thank you, Mr. Deliaco. Thank you, Dr. King. So for example, mga kaibigan, suddenly, wag naman sana, suffer sudden chest pain. I develop like that. And immediately, what are you going to do, Dr. King? You will hold me like this?
Chest pain, if you have
Yeah, I
that,
have chest
then I
pain
would
right
go
now.
to the little finger and go right to the fifth thoracic.
That's it. That's it.
Very simple.
You can do this in the office. Kung halimbawa sumasakit ang dibdib, angina pectoris, you hold my left finger and you touch here.
If it was an asthma attack, you simply go to the middle finger and
Uy!
hold the third thoracic.
Okay mga kaibigan, lumilipat na tayo ng karamdaman. Kung inaatake ng asthma, instead of the small finger, you hold the middle finger.
If
Okay.
you were having anaphylaxis, you would simply go to the clavicle notch right in the center
Okay.
and then T1.
Of
Have
the
C7 and T1.
C7 and
there.
T1
That's
sa
what makes
ilalim
it
nun.
large. It's
Okay.
the large one at the base of the
So,
neck.
asthma attack mga kaibigan is the middle finger. And for my anaphylactic shock,
Mhm.
it will be here and here.
And if someone was having a seizure, like a grand mal seizure,
Kinukumbulsyon na, all right?
you would actually hold both thumbs. Now, the difference here is you would want to get a good grasp because you don't want them to pull out from your
Yeah,
grip and be
yes,
causing
Yes.
brain cell damage and lesions in the brain from the seizure.
So,
So you want to get a good grip,
it's a
not for the
firm grip.
purpose of helping them, but for the purpose of them not pulling out from your hand.
I see. And this
Until
will
it's-
help already.
It will stop
For
the
the
seizure,
seizure.
in progress.
Oh, wonderful. Ang dami nating natutunan kagad, Mr. Deliaco. So, I will repeat. A heart attack using your left po mga kaibigan, left small finger. An asthma attack is your middle finger. And then allergic reaction will be here and at the back at T1. And then for your seizure, hawakan yung dalawang hinlalaki.
May I give you one that people will run across one time or another multiple times?
What is that, Dr. King?
Stopping bleeding, whether it's internal or external.
Bleeding mga kaibigan, kung may nakita po kayong nasaksak sa kalsada, nabaril, or what about bleeding from other sources, from the inside? It's also
It
okay?
will work the same.
What do you do?
Think of the center of the palm as the focal point, and you place that optimally right over the area that's bleeding.
Okay.
And then you place your left palm at a 90-degree angle over the
Oh.
right.
Okay, mga kaibigan, right pala, baliktad ako. Yung right, yung gitna daw, ay ilagay on top where it is bleeding.
Yes.
Okay.
And so to make it either a plus sign or an X.
And-
Now, no compress is necessary. You're not doing a compress.
Okay.
For instance, we've even worked this with, there was a little girl that had shattered glass all over her leg. You don't want to use a compress. She had a gash cut out of her leg. She was bleeding profusely. So what you did is you just cupped over it gently, not to
Okay.
squeeze.
Let me
And it
be
stops the
a
bleeding.
little bit inquisitive about this,
Sure.
Dr. King, Mr. Deliaco. In medicine, what was taught was, wherever it is bleeding, put as much pressure as you can so that you close the blood vessel. If you can tie it up, tourniquet it, or clasp your finger on top of it, do that. But what Dr. King is saying here is, just use your right and then your left and not too much pressure. How so? Why?
You're making great advancements. This is coming from scientific
Oh.
research and the understanding of how the body works from a physics perspective.
I
So all this
see.
is through scientific research making new advancements and breakthroughs in medicine.
Okay. Other questions, Dr. King now. A while ago, you were telling us to hold the thumb, hold the finger. Is it because you're transmitting a certain energy to me, or is it my own body that you're trying to repair or something?
It is your own body. There is nothing transferred either way.
There's nothing metaphysical or spiritual about this.
No, not whatsoever.
Wonderful, mga kaibigan. This is scientific and this is a very good way para sa mga emergency procedures natin. What about if your bleeding is, you're vomiting blood and that's because you have an ulcer and it's bleeding inside? Normally, what the relatives will do is panic
Yes.
after crying and shouting and spilling, and they will decide to go to the hospital. And then, of course, the nurses will take time to take down notes. When the patient is so pale already, then they will wheel the patient in and call the doctor, and the doctor will start with the IV and, give something to lavage it. In your case, what do we do for this case?
Actually, I would do several things. The first thing I would do is apply something for stopping the bleeding.
Stop the bleeding.
Now, the other thing that we're finishing today is the end of a 5-day course that trains you other therapeutic applications of the King Institute method to
Okay.
help correct the process to start with, including
Okay.
which would be the
Yes.
same thing after you stop a heart attack. Then you would apply other procedures of the Key method, which would be therapeutic to help address the cause.
Wonderful.
And we can also teach you how to find what the cause is
So
without
that is
using.
that is why you have the workshop.
Yes.
Ayun. So mga kaibigan, tomorrow, what they're going to do is to teach the emergency procedure for free. But when Dr. King comes back by November, it is to understand what is causing this emergency procedure so that after stopping the problem, now you can help further improve the condition.
Yes,
Yes.
and not only that, in the 5-day workshop, he actually teaches people hands-on how to do it on all of these procedures.
Ayun.
So you actually have demonstrations by the participants themselves on how to do this.
Oh, wonderful. Alam nyo, we are being watched by a lot of doctors out there,
Good.
even students. Now, this is something that I think your medical director will find quite different. Now, you're seeing a bleeding patient in your emergency room, where I've worked before also for a certain hospital. Now, you'll be placing your hand, this one, and then this one on top of it, instead of the usual clumping that we are doing.
He actually has a video of an actual surgical operation going on. where
Okay,
it's totally open,
okay,
and the surgeon is doing the procedure, and the nurse is doing this to stop the bleeding
okay.
without
that it-
compresses and without catheterization.
Doctor?
So obviously, it's not over the area that it's bleeding, it's at another location, which helps it just as well.
Oh,
Now, the thing
Okay.
is, there's 2 surgeries, and we're also going to show this clip tomorrow at the lecture.
you should have brought that clip, huh?
It's 30 minutes.
It's 30 minutes clip.
What we have on the second operation of that is they accidentally, accidents happen all the time in surgery.
Yes.
They accidentally cut artery.
Okay.
And without using cautery or anything else, they use the Key method to close that and seal it.
Wonderful. This will be very good for our next guest. Imagine our next guest is a surgeon, Dr. Cheng. Instead of reaching out for the clamp and clamping it out, you can try this also while you're trying to do your procedure pa rin. This has been a very wonderful interview. Anything else that's important to share?
Actually, in surgery, while the doctor is doing the cutting and everything else, it's the nurse that is doing this.
Yun. Oo. So it's really a
The surgical
helping
nurse
one
is
another.
doing this.
Yes. Oh. Okay.
Now, what we have in the training class that we're conducting right now is more than half of the attendees are medical doctors.
Of course. That
So
will be
we
very
want-
useful.
Our focus is when people have a problem, they go to the medical doctors.
Okay.
So we have a main focus of helping get trained all the medical doctors because this is non-invasive, non-toxic. You cannot cause harm. It's not interfering with your standard procedures.
Okay.
It's something that you can include with what you do, which will help greatly. And of course, we want to offer it because it is so very simple
Yes.
to anybody and everybody so that you can help one another in the family.
Yes, and we have nothing to lose, fellow doctors. Yung sinabi kanina ni Dr. King, may I hold your hand again, please?
Yes.
Yung left, using this and putting your hand at the back, Well, instead of just popping a pill, which is normal for us, doctor, we
Right.
get a pill. Okay, you're having an angina pectoris, a heart attack. I put this on you underneath your tongue, sublingual. Nothing is bad if I put my hand at the back of T5. Doctor, do they help to stop any medication while they're doing this?
It's
You're
not
suffering a heart
necessary.
attack. So
It is
you
not
can.
necessary. Yes.
You can continue with your medication if you're puffing something for your asthma while you're holding the middle finger. Ayun. Thank you very much, Dr.
You are
King.
quite welcome. Thank
Ang
you for having
galing.
me.
I hope you learned some few Filipino words. Ang galing means you're very good. Please
Thank you.
invite our televiewers out there. There's hundreds of thousands there who's now very interested, not only to ask you personally, but to see you in action in your seminar. Where will you be tomorrow? And what is the number that's best to get in touch with you?
Along with that, I would let Dr. Deliaco announce that, but I have a special heart for the Filipino people. I came here last November and I was very touched by the humbleness, the kindness of you, and I want to do all I can to help you. So the contact numbers will be 0917 833 3828. Now, as you can see on the screen, you can find out about the TKM from our website at www.kinginstitute.org.
Okay, thank you. Dr. Liliaco, anything else?
Just to tell you that the seats are limited for tomorrow's lecture to the first 150 because the hall will not
Wow.
hold enough.
150 people.
Yes.
There's about 500,000 televiewers out there for this program. How can you fit about half of that?
We
No.
cannot. That's why, please, if you want to go, make your reservations
So they have to
by
text you,
calling that number that we
call
told
or
you.
text that number
Call or text the number.
to
and-
reserve a seat.
yes, ask
Because
for
it's free.
Edna Santos.
Dr. King?
What I would like to do is there are hospitals, organizations, churches, different people that their heart is for helping people. And pretend you're not able to make this lecture or it becomes filled and you're not able to get in. We want to make sure you get the information, training, and the help. So please contact our contacts here in the Philippines and we will make arrangements to come back and help you any and every way we can.
Do promise that, Dr. King.
But we
Promise
would
that.
also appreciate it if somebody has a big hall, like the lecture hall of many hospitals here,
Or universities?
or universities,
Well, we can
or
facilitate that.
churches.
Okay.
or
or churches.
Yes.
So that
Because-
you can teach this to people.
So, but please, PCAM does not have, it's a nonprofit foundation, doesn't have funds. If you can offer the venue for free, and we'll take on from there.
In my
We-
mind already, I can figure out where you can sit 20,000 people so that they will be watching you on the spot teach this
For free?
for free. Because liligawan na lang po natin ang mga nandito sa ating UN television para yung hall natin ay malibre. But this is a public service to us Filipinos na hindi naman kailangang uminom ng maraming gamot dahil not all of us can afford so much medicine or so much surgery. Mga kaibigan, we are very fortunate to have Dr. Diliaco here and Dr. King to guest at WhatsApp Doc. More power po sa inyo.
Salamat po.
Salamat po.
Thank you. God
Salamat
bless you.
po. God bless you too.